ISD from Calloway County High School.
Everybody has a dream. Mine was to see the ocean. And with a little help, I made it.
We use our eyes every waking hour of every day. In fact, we're so used to them that we set aside the huge importance of them in our life. In this episode of Calloway Connections, we have invited local Dr. David Jaco from Eye Care Associates to discuss this topic. Hello, everyone. I am Tomás Salas, and welcome to Calloway Connections. First of all, David, thank you for coming here. Thank you for sharing some of your important time. So let's start this by just asking the first question that I think everybody's going to ask. Why should people go to the eye doctor and check their eyes out?
Well, that answer depends on the age. There's each age of your life, there are different reasons and more importances. So really from the age of, from birth to the first year, we like to check the baby's eyes to make sure that the eyes are developing correctly, that the eyes are working well together. We're actually part of a program called Infant C that was started by President Jimmy Carter. The American Optometrist Association, along with President Carter, started this program probably 15 years ago, maybe a little longer. And this allows the parents to bring their baby in to have that baby's eyes checked for free. So during that exam, we checked for alignment, make sure the eyes are aligned well, they're teaming well. We can also check for prescriptions. Most parents wonder how in the world are we going to ask the baby questions to know what the prescription is, but by just shining a light in the eye, we can figure out what the prescription is, make sure it's within the normal range for that age group. There's also reasons that are kind of scary. Sometimes we find tumors in the back of babies' eyes, which is obviously not a good thing, but we like to catch those things early. Then we get to school age, but before kindergarten, we recommend they have their eyes checked. Matter of fact, Kentucky was the first state in the country to create a law that requires students entering the public school system to have their eyes checked. What happens is a lot of parents think that their child is able to see because they're not sitting too close to the television or they're not squinting. But a lot of times that child may not know that they're not seeing clearly. That's just the best they've ever seen. And so we have to check their eyes before they can enter school. Sometimes, even though a child can see 20/20, that doesn't mean that their eyes are working properly. Sometimes their eyes have to work too hard to see 20/20. And from a school standpoint and from a learning standpoint, for lack of a better way of saying it, that takes too much energy away from the system, so they lose concentration and comprehension. And so those children will have somewhat of a learning disability, and sometimes they'll even act out in class. Even these smart children may struggle in school, and a lot of times it's because of their eyes. They have to work too hard, and so it's easier just to act out. Sometimes they'll be classified as a class clown. Sometimes it's mistaken for ADD or ADHD, and so we like to check the eyes for that. Then as you get older, we'll find that middle-aged folks that's when we start detecting early type of diseases like glaucoma, and those go undetected unless you have your eyes checked. The funny thing about that is men in particular are very bad about getting their health checked. They're not good about going to the doctor. If they feel good, they don't see a reason to go. But things can be creeping up, high blood pressure, maybe even their blood sugar. And so coming to the eye doctor is not really a scary thing. And oftentimes around the age of 40 to 45, they're having that trouble seeing up close. So they come see us. And that's oftentimes the first time men in particular will enter the healthcare system. So that's when maybe the first time they've had their blood pressure checked in a long time, maybe the first time that things have been looked at in regards to blood sugar. So oftentimes we can find things that may be affecting more than just their eyes. And then as they get older, senior adults, we have to think about cataracts, we have to think about diseases like macular degeneration. So each age group there's different reasons and different importances as to why they should have their eyes checked.
So I've done some research, and I know if when people don't understand that when you're doing when you're checking somebody's eyes, you can even know you can find out some diseases that actually doesn't have to do necessarily with the eye, like high blood pressure. I mean, checking your eyes can help you figure out more diseases that
That's
you
right. So it's funny that folks will don't realize, but exactly what you're saying is that blood pressure, diabetes in particular, those are the two biggies, because we look inside the back of the eye and look at the retinal vessels. Whatever's happening in the retinal vessels is also happening in other parts of the body. And looking in the eye is the only place that you can see what the blood vessels are doing in their natural state. So if you see narrowing of the arteries, then you're having narrowing of the arteries in other parts of the body. If you see leaky blood vessels, then you're having leaky blood vessels in other parts of the body. And so sometimes that's the only place, or only time folks will find that stuff out. Other things which folks don't realize, Crohn's disease, intestinal diseases will sometimes show up in the eye. Things like arthritis can show up in the eye. So a lot of times we detect things in the eye that have gone unnoticed. I can remember a patient that had a carotid artery blockage, did not know that. We checked his eyes, discovered that, and as a result had to have carotid surgery to prevent a stroke.
Well, David, you talk about the importance of going to the eye doctor, but what are the steps? And I actually have a video that can enhance what you're saying about
Okay.
what are the steps to what a normal person do when he gets there.
Okay.
Right? Can you show that? Can you show the video? You kind of explain what's happening
Okay.
here.
So first thing is choose your eye doctor. Most eye doctors have a website. Some of those websites will allow you to make the appointment online or at least request an appointment online. Obviously, you can always make a phone call and request an appointment. Then you want to bring any insurance cards, whether it be vision plans or medical plans. You want to bring a list of your medications that you take. Then arrive for your appointment. Again, the appointment's a very simple procedure. Typically takes 30 to 45 minutes. So we get you checked in. We check your eyes for vision, check your eyes for a prescription for glasses or contact lenses if you like. We also check for the ocular health of your eyes to look for the things we just discussed. After that, we take you back into the optical area if you need glasses. Let the patient choose the glasses. Takes about 5 or 6 days to get your glasses back, return for a proper fitting of those glasses. Very painless procedure. So a lot of folks dread going to doctors in general, but typically going to the eye doctor is not a scary thing.
It's not a scary thing. So, more talking about, I know you have been in this profession for a long time. What's some of the technological change that you have seen through the past of your career, I guess?
Yeah, so just like technology is really changing in all facets of our lifestyle, you know, everybody's got a handheld computer, really, a cell phone that they can do so many things with. Same thing has happened in eye care. So 20 years ago, really all we could look at was just inside the eye with a scope. Sometimes you could, you would take film pictures. Now, of course, we have digital photography that will allow us to take pictures of the inside of the eyes. We also now have ultrasound images that we can take of the retina. Probably 15, 20 years ago, the only way that you could get the same image type pictures was after a patient was dead and actually in a cadaver type situation under a microscope. So now we can get that in less than a minute's time, show that to the patient in real time. We can actually even do those in 3D images now and kind of scan through that so we can see swelling, we can see separation retinal detachments, things that we couldn't see are in this type of detail 20 years ago. Now we even have a method of checking to see if the optic nerve is working properly. So the charge, as the light comes into the eye, creates an electrical charge. That charge travels the optic nerve to the back of the head. Now we can determine and detect the strength of that charge and how quickly it makes it back to the brains for processing. So we look for glaucoma, we look for things like multiple sclerosis, doing those type tests.
So now that you just mentioned some of the diseases, some of the most common diseases that you can encounter while you're doing an eye check to
Yeah,
somebody?
so I think some of the most common, of course, cataracts. I tell folks everybody's going to get a cataract unless they die too young. Everybody will develop a cataract. That's usually caused just from ultraviolet light over time. Sunglasses will help that, but ultimately it's just an aging process. So that is an easily fixed problem. Usually takes 15-20 minutes for a surgeon to fix that. Glaucoma is probably the next most common disease that we deal with. That's a process where the optic nerve gets choked off. It doesn't get a good blood supply, and so you have nerve damage, and that can lead to blindness. It's a very slow, painless disease, and as such, folks typically won't even know they have it, and that's why it's important to have their eyes checked so that we can determine that. Macular degeneration is another disease that we see quite a bit here, typically in our senior adult population. It's basically a decaying of the retina, a scarring of the retina. So if you think of the eye as a camera, the retina is the film of the eye. And so if macular degeneration creates wrinkles or holes in the film of the camera, and so it doesn't matter how many pictures you take, you're going to have distortion, you're going to have holes in that picture, and that's what macular degeneration is. There are some treatments for that. Unfortunately, that's one of those things that we usually just try to slow that process down.
Okay. I know you mentioned, can you do cataract surgery?
Optometrists cannot do cataract surgery. Ophthalmologists do the cataract surgery. In Kentucky, we are able to perform certain laser procedures. So after cataract surgery, oftentimes the membrane behind the new implant will cloud up, and optometrists are allowed in Kentucky to remove that with a laser. It basically just opens up a hole, just like a frosted windshield. You do not scrape a hole to see through. That's what the laser allows us to do. So there are some laser treatments also for glaucoma that we can do if drops quit working. We use drops to lower the pressure with glaucoma, and if those drops quit working or don't work well enough, then we can use a laser procedure to open up the filter of the eye so that the fluid can get out quicker, and that lowers the pressure. So we do some procedures, but cataract surgery is still left up to the ophthalmologist.
Okay. So talking about the technology, you just mentioned that the technology has changed a lot in the past, like 20-something years ago.
Mm-hmm.
But with this being said, you think in the future there's going to be a time when people are not necessarily going to need to use some like glasses, let's say?
Well, I think that day may come. There's many procedures out now that allow folks to go glasses free for a period of time. A LASIK procedure is done where they reshape the front part of the eye called the cornea. That has its limitations. There are certain prescriptions that are not able to be corrected with that procedure. But I believe that in the future things will continue to improve, and more of those prescriptions will be correctable with those type procedures. There's also different type of inlays they can put inside corneas to almost like the aperture of a camera that will give a pinhole effect, which will also do some focusing. So there's all kinds of technology and techniques out there now that will allow folks to be glasses free, at least for a time period. And I believe as time continues on, those barriers will be removed, and more folks will be able to be helped with that. With stem cell research and stem cell technology and abilities, really the sky is wide open as far as where we may end up going with all of this.
Okay. So to wrap all this episode up, you say to the people that have kids, you're one of the person that talking to the parents that they need necessary to make the kids do. Well, not everybody should go actually to see the eye doctor, because you're also you use your eyes for everything, right?
Mm-hmm.
So exactly that. Everybody should go to the eye doctor, no matter what.
Everyone should go to the eye doctor. 80% of everything you learn comes through your eyes. So if a child is having difficulty seeing, difficulty for that image to make it to the back of the head and for comprehension and to soak in, then that's slowing down the process of learning. And so if your eyes are not working, you're missing out on a big part of your learning abilities.
Okay. Well, that was it for the episode today of Callaway Live Connections. I hope you guys enjoyed.